Hello, everyone. My name is Dr. Allison Stiles. I'm a clinical psychologist at URMC, and I'm excited to walk through our new project, You Are Supporting Our Students, with you all today, focused on enhancing school teams' response to teen mental health challenges. A little bit about our team here. So Dr. Melissa Heatley is the project director for UR-SOS and will also be the project lead for ECHO, the ECHO component of UR-SOS. I'll be co-directing the project and leading the youth mental health first aid arm of the work. And then we're also joined by Dr. Linda Elbert-Gillis and Corey Nichols-Hadid for senior advisor and project coordinator support. So UR-SOS has 4 overarching components that I'll talk through in more depth today, including the Project ECHO, youth mental health first aid training, school-based referral process for short-term treatment, and access to current tools and resources in your community that are focused on supporting teen mental health. Before we get into that, I want to recognize the state of where things are and how this project came about. So as many of you already know, we're experiencing a mental health crisis regionally as well as nationally. And past surveys among youth in Monroe County have found that 38% of youth are experiencing emotional difficulties, 14% were considering suicide, and 7% had attempted suicide. And we imagine that these rates are probably an underestimate given the current condition of things in the pandemic. Of further concern, national estimates are indicating that only about 1 in 5 youth are actually receiving the services that they need. And of those who are accessing services, 70 to 80% of those are happening through schools. On a local level, we also see that schools are the most common entry point for youth mental health service access. And teachers are increasingly on the front lines of providing mental health services to kids and teens, but often lack the knowledge and skills that they need in order to support youth behavioral health. So one of the goals of UR-SOS is really to be able to strengthen the ability of middle and high school educators across our Finger Lakes region to learn how to recognize and respond to teens with serious mental health or behavioral health concerns. And each of these 4 components that I'll talk through are interconnected. So we have the members of your UR-SOS team that are all participating in this Project ECHO. And then 1 member of your UR-SOS team will be identified as a trainer in YMHFA, Youth Mental Health First Aid Training, and they will provide subsequent YMHFA trainings to your district, allowing for this far-reaching and sustainable capacity building within your district. And then a member of your UR-SOS team will also be trained in how to refer students for our short-term intervention services. And you and your district will also gain access to tools and resources for how to support youth with mental health concerns. So as I mentioned, UR-SOS really provides an opportunity to strengthen your district's ability to identify, approach, support, and connect youth who have mental health challenges with services. School districts increase their capacity for mental health literacy in their district and community through YMHFA dissemination. And really in this time of isolation and burnout, you are able to receive ongoing peer consultation and expert support around some of the most challenging cases that you might be facing in your school districts of kids who have mental health challenges and are in distress. You also have the opportunity for priority access to the new school-based referral stream for short-term intervention services, which will allow students to be able to access services more quickly, and then also gain access to that aggregation of community best practice tools and supports for how to address mental health challenges that arise and how to connect youth with the services that already exist within the community. Educators also have the opportunity to receive continuing education units for their participation, and as well as social workers and administrators during the ECHO component of our project. So let's talk in a little bit more detail about the various components, starting with the ECHO project. So what is Project ECHO? Project ECHO is really, it utilizes a telementoring model to really build knowledge and skills for how best to support teens with serious mental illness through both expert training and case consultation. And so during each ECHO session, there'll be a short didactic presented by an expert in various topics related to supporting youth with serious mental illness. And then the remainder of those sessions will focus on case consultation, during which each team will present different cases and receive feedback, both from the experts as well as from peers, in this really teach all, learn all model. So each month, the biweekly ECHO sessions will focus on specific topic areas, as I mentioned, and those include recognizing and approaching youth in distress, thinking about school-based safety planning, response to crisis and de-escalation strategies, referral to treatment and awareness of community resources, and then other special topics related to serious mental illness among teens. And for these didactics, we're joined by experts in the field each month, so including Dr. Tony Pisani, Dr. Mike Scharf, Dr. Jim Wallace, and Gerard Johnson, as well as a member of the Monroe County Office of Mental Health. And so each of these folks will present on various topics related to youth mental health that I mentioned during each of those ECHO sessions. Another incredibly important and useful component of Project ECHO is really about that peer learning process that I mentioned through case consultation. So during each ECHO session, different school teams will present on a de-identified case, and then we'll have time to be able to collaboratively problem solve, to identify evidence-based solutions and brainstorm next steps with the participating school teams as well as those content experts. So what types of cases might be appropriate to present? These cases will be about students in your school who are experiencing mental health challenges, and they might be cases that are common mental health challenges that you notice coming up, anxiety or depression, ADHD, or it could be that these are cases that are more challenging and complex and perplexing for the school team, and you really want some additional support in kind of co-managing those difficult cases that are arising. So we'll ask you to complete a form as part of that case presentation. And in that form, you'll complete information about the students in terms of demographics, primary concerns, or questions that you're hoping to have answered during that consultation. You'll describe current mental health symptoms, including things like changes in duration, frequency, severity of those challenges that you're seeing. You'll also talk a little bit about past or current treatment strategies that you all have tried, and then just briefly relevant history about the child. An important piece of this, and we are happy to walk through this process with you the first time that you're doing it, or whenever you're doing it, to be able to make sure that you're getting all the information that you need on there. Something I also want to stress is that it's really important that these are de-identified. So once you complete that case presentation form that we just described, you'll then be sent from us a confidential ID number, and you'll use that to identify the student during those ECHO sessions to make sure that no identifying information is shared. And so through this approach, we can really see how quickly information can be shared between the experts and the school teams and back and forth, and then eventually disseminated out at the same time to school community, your school community, to families and to teens, really ensuring that youth and families are getting the care that they need when they need it, close to home. So breaking down some of those traditional barriers to being able to share information and access to treatment. And by allowing for these different avenues of learning, through the didactics, guided practice, through peer learning during the case consultation, ECHO really creates this dynamic learning loop that really ensures sustainable changes in practice and knowledge. So to summarize in terms of kind of next steps and what's coming, UR-SOS teams will be participating in these hour-long ECHO meetings twice a month from February through June, so for 5 months. And we ask that school teams present at least one case during this time, but are welcome to present on additional cases as well. We also ask that teams are engaged during those echo sessions and offer support and a listening ear and feedback for their peers during those case consultations. And then we're also happy to share that we're able to offer up to 10 continuing education credits for free for participating educators, administrators, social workers, and nurses. So moving on to the next component of UR-SOS, youth mental health first aid training. So you have the opportunity to establish a youth mental health first aid instructor within your district. First, just talking a little bit about what youth mental health first aid is. So for those that aren't aware, it's a 6.5-hour course that teaches adults who work with teens and how to recognize and to effectively respond to mental illness and substance use disorders among youth through really specific knowledge and skill building. So when people participate in a YMHFA course, they're taught how to identify risk factors and warning signs of a variety of mental health challenges that are common among adolescents. So anxiety, depression, eating disorders, ADHD, substance use, to name a few. So participants are not learning how to diagnose, they're not providing therapy or counseling. Instead, this is really about helping those participants to learn how to interact with and support youth by applying this core 5-step action plan. And so through this action plan, LG, they learn how to assess risk of suicide or harm, how to listen to youth without judgment, how to provide or give reassurance and information to that youth in need, and then how to encourage appropriate professional help or self-help or other community supports that might be necessary. Trainings also cover some additional topics around teen mental health, such as trauma, substance use, and concerns with social media and bullying. So as I mentioned, UR-SOS then provides an opportunity for one of your UR-SOS team members to become trained as a YMHFA instructor, a trainer. And so then that trainer in turn is able to deliver YMHFA classes to other adults within your school district and community. So YMHFA instructors, they might give these trainings to adults who have no prior mental health training. So they could be school administrators, educators, paraprofessionals, teachers, coaches, community members, really anyone who works with teens. This is designed for people without prior training. As an added incentive, educators, as I mentioned, will also have the opportunity to earn free continuing education credits through participating in the YMHFA class. And so in terms of next steps for your team, the first step is to identify a member of your UR-SOS team to become that YMHFA instructor within your district. Next, that nominated individual will participate in a 3-day instructor course training that really presents that mental health first aid training course and provides in-depth instruction on facilitating the curriculum. So the training typically will include self-paced pre-work, as well as a written exam and presentation that occurs during that training over those 3 days, and really evaluates the candidate's ability to present youth mental health first aid content to a variety of different audiences. The instructor training will be held on March 23rd, 24th, and 25th for this round of UR-SOS. And those are full day, 8-hour days. So typically it'll be 8:30 to 4:30 on those 3 days. And then following that training, YMHFA instructors are required to teach the course 3 times over the course of that first year. It's not required beyond that first year to continue to teach 3 courses a year. However, if you'd like to maintain that YMHFA certification, it's recommended that you do so. And during that first year, UR-SOS trained instructors will also have the opportunity to lead at least one of those courses with a URMC partner to help support and troubleshoot during that first round. And then we also will, we encourage the UR-SOS teams to really think creatively about how they might incorporate these youth mental health first aid trainings into the school year. So thinking about potentially as professional development days for educators and staff over the course of the next year to participate in a YMHFA course. And we're happy to partner with you to think about and get creative around how other schools have been successful with this process and what might work for your school. And so becoming a YMHFA trainer really is a unique opportunity to make powerful and lasting change within your school and your community. And you can see how, similar to the ECHO model, we're able to really have this exponential reach that creates sustainable change within the community as the knowledge is shared out from one individual to multiple groups and beyond. And by gaining that skill of disseminating crucial knowledge for supporting youth with mental health, you're really able to bring together the community to decrease mental health stigma, increase your community's literacy, mental health literacy, and to also be able to empower adults around you to be able to support the youth that are in need. So lastly, in addition to those core capacity building components of UR-SOS, this project also allows for, as I mentioned, that priority access to our new pilot school-based referral process for short-term interventions services, as well as a toolbox of best practices and community resources for supporting teen mental health. So we have 2 short-term intervention services that school teams will have priority access to. The first is our START program, short-term assessment and response team. And the goal of this program is really around providing quickly accessible short-term intervention up to 6 sessions to help families stabilize and manage current stressors. So families are able to access this short-term crisis intervention within typically 5 to 10 business days. So it's quickly accessible. And that service includes both assessment of the current challenges that the family is experiencing, as well as really creating targeted treatment goals to address those immediate challenges. Appropriate START referrals include teens and families with significant distress related to an identifiable stressor. So youth who have immediate safety concerns or need same-day evaluations or are already receiving services are not a good fit for a START. And we'll work to coach your team on how best to identify these referrals. So the short-term READY service, the second one, is called READY. And READY offers accessible short-term treatment for youth who are at a lower risk and are really ready to engage in developing skills and increasing awareness. So READY includes up to 12 sessions. Typically it's 8 to 12 sessions, focusing on that skill building, that awareness building, to really make some quick and impactful change in that child's life. READY offers initial evaluation and goal setting, typically involves psychoeducation around the challenges that that child's experiencing, focus again on skill building, and then thinking about discharge planning and how to connect with future goals, other community resources that might be necessary. Additional components here might also include medication consultation or trauma narrative that to augment the treatment that's being done. And so to access these services, what we'll be doing is we will be meeting with one member of your team to train them in how to access these short-term intervention models. So we'll help them to understand what these models are, how to talk with families and school teams about these short-term models. We'll also coach them on how to identify appropriate referral cases for READY and for START, how to triage those referrals, how to complete a referral through our online referral form, and then how to follow up as necessary based on the needs of that referral. And we'll be setting those up likely sometime in February with a member of each of your teams. And then lastly, UR-SOS teams and your districts will have access to an aggregation of tools and community resources to support teen mental health. So this will include community resource lists with up-to-date local resources for supporting youth and families with behavioral health needs. It'll also include best practice tools. So this might be things like the Columbia Suicide Scale for screening students with potential suicidal ideation, and other evidence-based assessments and intervention tools. It'll also include regional exemplars of models for supporting youth with behavioral health needs. And so we're really looking forward to moving forward on this exciting opportunity with you all and connecting over Zoom in the near future. But if you have any questions, please feel free to reach out to our project manager, Corey Nichols Hadid, with any questions in the meantime. And we're excited to move things forward and get them started.